Good evening, everybody, and welcome to Board of Health meeting Monday, September 20th, 2021. Let's see, tonight we have a couple of appointments. Sue, do you want to make the introductions?
Sure. This is Patrick Franey, Building Commissioner, Scott Turner from Environmental Partners, and they're here to kind of introduce you to our new Technical Review Advisory Committee and some of the stuff they wanted to talk to you about that committee. So.
Excellent.
I shouldn't say new, it's been going on for a few months now, right? So newish. We just got officially named.
Yeah, Patrick named us. I don't know where the name came from. But yeah, that's it. Technical review.
Yep.
The idea behind it, we're trying to make a coordinated effort from all the departments to review projects ahead of time before they get to the boards, planning, conservation, health, everything. It's a collaborated effort. It's about communication. What we're trying to do is get the projects, get the permits issued quickly. It's actually expedited permitting is really the premise behind it. And we're hoping to do that by helping the applicant create a better set of plans before they come in and submit them to the various boards. Anything, what I miss?
No, I think that's exactly it. So my name is Scott Turner. I work for Environmental Partners.
Hello, Scott.
Our firm was hired to work with the town, do technical reviews, but also be there in an advisory manner for this track committee, which I attend every other week or twice a month. So my background is I'm a professional engineer. I'm registered in 6 states. I have a degree in city planning, and I'm a member of the American Institute of Certified Planners. And been working for probably close to 30 years, mostly in different towns, taking projects to towns to be approved. And so, whereas you see applicants, for the bulk of my career, I have been the one bringing projects, or one of the folks bringing projects to different cities and towns. And so I think that gives me an interesting perspective on both on how the applicants are approaching municipal boards, but also because I've worked in so many different towns, I tend to lend some advice as to how I see things done in other cities and towns as well. And I think so far we've definitely are moving in the right direction, in my opinion, in terms of providing reviews and also trying to streamline the process, like Patrick said. And I think it's great that the town is moving in that direction.
Yeah, we're hoping, that's why we're here tonight. We're trying to communicate better with all the boards, so we're letting you know that we have, there's a every other Wednesday right now we're meeting. And at least one member from every board or every concerned department with any project in East Bridgewater is a part of this
So
meeting.
just to clarify, it's not really board members, it's actually mostly all department members.
Staff.
with the
Right,
exception
staff,
of one board,
right.
yeah, staff, yeah.
Somebody's there though,
Yeah.
and we're hoping that all of the boards will be kept aware of all these projects happening. And if, a lot of times with the projects, what happens is if people bring forward a set of plans and they get all the way to let's say to the planning board stage, and there may have been something that another department was concerned with that plan, if it's not brought to their attention until they get to the planning board meeting, and they might have to change their plan, continue it to another meeting, and it just delays the process. If they had just known about it ahead of time, they would have been better prepared, and that's really what we're trying to do.
Gotcha.
And answer any questions that you guys might have.
Is there anything particularly you think you will do with us? I mean, I'm picturing your involvement with us as being major projects. Like, we're not going to send the emergency repairs of septic or someone's Title V over you guys for review, but a large subdivision with lots of multiple septics going in at the same time, that might be something we toss your way, right? Is that the general plan?
I would think so, most likely larger
Not for
projects.
single-family house lots.
No,
but
but maybe
Like,
larger.
so right now, with the only one we sent so far is 0 Plymouth Street, which is Barbara Rollins, which was when you guys first I think, the beginning of your tenure here, but it's been through a few meetings, and it's right there at the end right now. So you will see that plan hopefully soon. We're waiting for Silva Engineering to do revisions they agreed to do for environmental partners to
Yeah.
bring it up to code. So that will be hopefully on your next agenda, with any luck. We have a couple of lots on Harvard Street that I'm a little concerned about that are in conservation right now, so I'm waiting for them to get to us. And when they do, I'd probably ask you if you wanted to send them to environmental partners. There's, I'm not sure if you're familiar with Harvard Street, it's kind of where the beaver is there.
Yeah.
That field that's been for sale.
The sod farm.
Yeah, it's underwater, so those are a few lots that you might opt to send out for a more thorough, because it's gonna be, stormwater is gonna be involved, wetlands are gonna be involved.
Yeah.
I'm actually looking, I have
Did
we
they-
just
did
had an approved proposal.
They did?
Yes.
Okay, Kim did
so-
let me know, okay, so, all right.
Yeah, so I think I've got this backwards. So we're sending our projects to you. I was under the impression that you guys got them first and then kind of proofed them before they went to the other departments.
So, it depends on the project. So, in an ideal situation, as Patrick said, an applicant will come into the committee, and that's an opportunity for all the different departments and all the different
To
boards
do everything at once.
to kind of talk about things that they see. And there are other municipalities that have done that for a long time. And as I mentioned before, I've been in those meetings as an applicant, and I always find them very, very helpful. And then, once they actually file their applications, depending on the scope of the project, we will, if, Board of Health wants us to look at project, if Planning, Conservation Commission, if they want us to look at projects, we will look at them. So far, I think I have 7 task orders. Most of them have come from Conservation, but some of them have been for everything. Like, Zero Plymouth Street was really comprehensively for all 3 boards. And I agree that we shouldn't, it's probably not worth the effort, the time, the money for small house lots to come to us. I think that, if you have a pressure dose system, a larger system, a shared system like Zero Plymouth Street is, then, we make some comments that I think improve the project. And so far, the feedback we've received, both from the applicant and from the boards, has been positive. So I think it's a good process.
So far, so good. And we have, there's a couple, I think we have a couple industrial projects coming up in the works that they'll be all encompassing planning and stormwater, so that it's smart to send that to environmental partners, because they're gonna look at the big picture for everybody.
So are we there on the every other week meeting? Or is it just something that,
I'm there. Yeah.
okay, so,
Yeah.
we do have representation. All right, great. Anybody else? That's all, I just think it's a great initiative. Go ahead, I'm sorry.
I'm sorry, Patrick, did you wanna, we talked about, were we gonna discuss the financial aspect? Bills?
Oh, right, that would be up for the board to decide, and we weren't sure how are we doing that?
So
Prior.
when a project, like right now, when a septic system comes in, they give us a fee, it's $200, that's our fee. But when it goes to environmental partners, for any of us, we send them the project, they do a task order, is that what it's called?
Yes.
Yeah, task order, and, exactly what they could do for us and what the final cost would be. So for like Zero Plymouth Street, it included Board of Health, Planning Board, Stormwater, and Conservation. They kind of broke down Stormwater and Conservation, I think, into 2 different things, for a total price. And that check was deposited into an engineering account, kind of like when a developer comes in and does a subdivision. So now, when we get bills in, it could be a Board of Health-related bill, it could be a Planning Board-related bill. The idea is to have everything kind of filtered through one person, so, Kim's not paying a bill, and Patrick's not paying a bill, and I'm not paying a bill, and we have no idea where we stand as far as how much money is left in that account. So the idea we discussed at the
Yep.
last meeting was because planning and building is a full-staffed office, and they have already got the engineering account set up for subdivisions, that they could all filter through planning, building, and we would be copied on all the bills, and we would have to approve them still. So if it's a Board of Health bill, we would say, yeah, we authorize that, we're gonna pay that. But it's not our money, it's the applicant's money.
Our question for the boards is just that. Each board, I believe, can set up, for larger projects, if you did need a third-party review, you can set up a separate engineering account that the applicant would have to deposit money into, and you would use that money to pay the environmental partners. What we're wondering is could we just have one account? If the boards all like it this way, and for all of the engineering review to go through basically just one account. I know all of the departments could deposit and draw from, but it's
Which makes
it's
it
basically
easier
that
for-
it, and we're just looking,
Yeah.
I mean, not like we're looking for an answer right now, we just wanted to come to the board and say, this is probably a good discussion for you to have.
Instead of
So,
asking Barbara for a check for Board of Health and a check for
yeah,
conservation, a check for planning, we did, this is the amount for the entire review. And then there'll also be an amount, and I think it's already done, for all the inspections, correct?
Yeah, I mean, that would be,
That'll come later, but, so
Well-
instead of having him to give us 4 checks and I deposit it into a Board of Health engineering fund, and
okay.
there's one check that was deposited into one account, that's
I see.
covering all the reviews.
So instead of the money coming, instead of us getting a check and then depositing it into our account and then paying that invoice out of our
Trying to
account.
make it a unified
It's a one,
effort.
one check for the party, and then it all comes out, gets spelled out according to what board owes what, for what inspections or
Pretty
services.
And those fees are just basically, it's just whatever the task is checked off, and there's a dollar amount associated with it, and that's what our liability will be for that project. Is that my
It's so-
understanding how it works?
If you remember the engineering account from planning board,
Yep,
it's
yep,
exactly that.
okay.
Were you gonna-
but when we give a proposal, because it's really hard for us to say, and actually, if we did it this way, it would be more expensive. If we said, okay, Board of Health is gonna be $1,000, and planning is gonna be 3,000, and conservation is gonna be 3,000, it's easier for me and the other folks that I have look at it, just look at everything at one time.
Right.
You know what I mean? So,
Sure, sure.
so we don't ever put a price on, okay, this is Board of Health, this is conservation, this is planning. It's like, this is what it costs to review the entire project for whatever we've been asked to review.
So how would we determine what our fair share would be?
Well, it's not our money, though, it's the applicant's money, so it's
That's
not
right.
like, nothing's out of our budget.
We just have to approve the money
So we
for
just
us
have, we
leaving.
just have to
We don't make
say
a
it's
profit
okay to
off
pay
of
him.
Well,
It's
no,
just,
that's,
yeah.
it's not a revenue stream.
Yeah.
It's just,
No, I believe the way it would work is if you had an applicant that has presented a plan to you that was extensive enough where you thought it warranted third-party review,
Mhm.
then you would have that applicant
Okay, gotcha,
deposit
that's right.
funds into this account, so that when you sent it for the third-party review, that's what it would
It's,
get
it's
paid.
already funded, the money's there.
So if you didn't have any plans going through third-party review, it wouldn't affect you at all.
Gotcha. Okay.
So just a quick question. So if someone had a septic system, say it was $200, and we decided it needed third-party review, would their fee for their septic system then increase to cover the third-party review?
So it would not be the 200, we'd give them the new amount and not the $200. So
Okay.
technically, I'd probably give them back the $200 and have them write
And
me a
have
check, or
them do it to the other company.
Because it's gonna
Okay.
go to a different account, yeah.
Okay.
And where's everybody else falling in, are we all looking at different, the different boards looking at just one central, just kind of like what we were talking about?
We're hoping to speak with all the boards, but you're first.
Oh, really? All right, great.
One
Thank you
off
for
is
that.
my heart.
So it seems it was a consensus with the committee,
Yeah,
but
okay, good.
we thought.
That
it'd
was
be
one of our
prudent.
biggest complaints was last year, and I think, Mr. Rollins and Mr. Payton was that, they go to one board and they want a check for this.
Yeah.
And then they go to another board and they want a check for this. So then we're just being upfront. This is everything. This is how much it will cost for everything.
Yeah.
Okay. Excellent. Anything else?
Do you
Folks?
when do you need an answer for
Oh, we
the
don't,
collective funding
I don't think we,
account? Like, are you going to each board and asking their opinion and then getting a vote for each board, or?
yeah, I believe so. I think that's what we'll end up doing, is asking each board's opinion, and
So so Zero Plymouth Street started with Kim, so it's kind of gone through, a lot of the applications won't start with us because they're gonna go to like Stormwater or Planning Board first, and we might be an afterthought. So have you billed Kim for anything yet?
Have.
Okay. So, and so you.
And then I
did-
think going forward, I'm probably just gonna direct all the proposals to Patrick,
Yeah,
because I know Kim's not.
right, she's only kind of filling in,
Yeah.
so. So I don't, you may have already paid for some Board of Health stuff, I'm not sure.
Yeah, there was some, I mean,
Yeah.
well,
So the Conservation
we've
Commission
billed,
approved the
I
bills?
don't think we've
Oh.
been paid.
You don't think you've been
That's
paid?
not it.
Okay,
Yeah, I
all
mean,
right,
and that's just,
okay.
I'm not.
That's
trying to
okay, no,
ask for
no.
payment, I'm just
No,
saying,
I'm just,
it has
yeah,
to
I'm
do
just
the
questioning it.
process,
So I'm gonna check with her on what she's received so far.
Okay.
Excellent. Anything else, guys?
Nope.
All right,
That's it.
fantastic. All
Okay.
right, thanks for coming in.
Thanks for your time.
Thank you.
Appreciate it.
No worries. And then Sue, can you put that on 10-4's agenda?
Yep.
And we'll just get that out of the way. Okay, we're gonna slide down to action items. Disposal work permits. We have 8 Hudson Place, 47 Folsom Ave, 814 Central Street, and 1826 Central Street.
I don't have it.
Eight had some place in there, yeah, let me run it.
I don't have it, yeah.
It's okay. Let me-
8 Hudson's missing.
I don't have it yet.
No, I think you may have signed that at the last meeting, hold on. Look at
I
my
think we
agenda.
did.
Hmm?
I think we did sign it.
Yeah,
I
I
have
might have
it
left it
right
on,
here.
I might have left it on there inadvertently, so let me just look. You can, if you want to, look at the other ones while I'm looking that up.
I do
8
have it.
8
Yes,
Hudson
it
was
last
on
week.
last
Yeah, okay.
week's agenda. Okay, so we'll scratch
Yeah.
that. So again, it's just 47 Folsom Ave, 814 Central Street, 826 Central Street.
Yep, 1814 and 1826 are our new house lots. 47 Folsom is a repair.
Okay, I'll entertain a motion to accept these as presented.
Motion?
Okay, it's a motion Lisa, second Matt, all in favor, say aye. Aye, these pass unanimously.
So, you weren't able to get that information to me for the minutes, so I don't have those printed for.
Right, yeah, I was just a push. It's gonna have to go on next week's
Okay.
agenda, or next meeting's agenda. And no invoices, Sue?
Nope.
Okay.
I have an installer's license in my phone.
Yep, I mentioned to them before you got here, I apologize. So the installer's license, that's not on the agenda, originally got their license back in January, when I had been out sick, and unfortunately, there was no photocopy made in my absence, and they needed a copy of it, so I told them I would have you reissue it, so they could
Okay.
have a copy for their records.
So this is reliable evacuations,
Reliable excavations, yep.
excavations. Okay. So this is already voted on, right? This is a copy?
Because I don't have
It's a
a copy of it,
reissue.
everything, I would
Okay.
sign.
Okay,
Yeah.
all right.
So do we date that for now, or do we date it from the original? Because are they renewed
I mean, I have
yearly?
the check and everything back from January, so,
I only ask, I'm
so the
just-
permit itself is not dated, this has an expiration date.
Okay, all right, that's,
So-
I was just thinking if
Yeah.
we did it now, then their permit would
Yeah,
be out of.
they're
the-
all good through December 31st, no matter
Okay.
when you get them.
Okay, so I'll make the motion that we accept the reliable excavations permit.
Motion?
Motion Lyons, second Lisa. All in favor, say aye.
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 Passes. Okay, so that's that. So I don't see it on here, but we have the note from Montana.
It's on discussion.
Discussions?
Yeah. 30
Yep,
Andrew
I
Road.
apologize, there it
Yeah.
is, 30 Andrew Road, okay. All right, we'll go back to the action item number 4. We'll just quickly go through the discussion items, and we'll circle back to number 4 on the action items. So with 30 Andrew Road, I mean, this is a pretty extensive report, but I think it's moot because the individual's no longer living there.
Correct.
Okay, so it's just, at this point, it's information only. And I don't, we could respond in kind to, to Montana and just that, thank you for the information, but until somebody's living there, just
Well, I think I think, and you can do what you want, you're the board, but I think maybe, she did state that he was showing the apartment for rentals, so I don't know if we maybe want to let him know that we received a report and that it should be addressed prior to renting the unit out again, before we, I don't want to knowingly rent a unit with an
So-
issue.
Is there anything under the Board of Health's jurisdiction that involves inspection of rental properties between tenants?
Yes, so it's not a requirement under the code unless it's over so many units.
Yeah.
But a lot of towns have so that, I'm sure you pay a fee, for the inspection, but they're like, a lot of the bigger cities obviously do it, but they do free rental inspections. It's kind of good for everyone. So right now, like Section 8 actually requires it. So a lot of times, you get a call saying, I need an inspection for my rent assistance, because they want to make sure they're renting out a healthy apartment.
Mhm.
So we could certainly get some other towns' policies.
Policies, yeah.
Or see what our surrounding towns have and adopt something similar.
It's something I know exists, I know it's something
Yeah.
we've never really done
I know,
before.
if it's over so many units, which I don't think we have any buildings that meet the threshold here, it's a requirement.
It's a requirement,
Yeah.
but we don't hit there. Okay.
I mean, I would just dismiss the letter,
Okay.
given the fact that the two parties are in a very heated debate.
Okay.
She's no longer a tenant. He could be showing it. It doesn't mean that he's showing it with the damage. This damage was not damage that was brought forth in her original petition.
So it
And
does include the basement though also, not just the,
the wall, yes.
Yeah.
Which isn't necessarily a living area, but
Yeah.
I
Yeah,
think
that's
I'm assuming that any person who's seeing is gonna see what's going on there anyway.
but, is there a consensus from the board on that, or when I get a little
I don't think there's no harm, no foul sending this to Mr. Savino and just reminding him that, if it's gonna be rented, it needs to be taken care of. Again, it's the individual who sent this to us is no longer there.
Right, no, exactly,
So
yeah,
we
so there's
can't-
no, and I told her that, I said, she, and I know it's already in court, so I'm sure there's some more extenuating circumstances. I obviously can put it in the file, and anyone that's interested in buying it is gonna come check the file, and they're gonna
Yep.
see it, we'll go in the file anyway. So,
And I know I asked you when you first sent this to us by email whether or not she had brought this to her landlord's attention initially before sending it to us.
I think she
giving
sent
him
it after she sent it.
The opportunity to repair anything she
I'm
wants to
sorry,
complain
I
about.
apologize, my ears are all
Oh.
clogged. Sent it to who first?
To her landlord first.
Oh, to the
before-
landlord,
Before
okay,
making
okay.
it as a complaint to
Okay,
the
I
Board of
didn't know
Health.
what she- Okay, lawyer, landlord, okay,
Um,
gotcha.
As I think that would be the appropriate action. I have a problem in my apartment, I'm going to notify my landlord before I notify the Board of
Mhm.
Health.
Mhm.
But we're already dealing with a contentious
Yeah,
issue
we
here,
are,
so.
Okay, so if you want to send this to Mrs. Savino, go right ahead, and then we'll just, like you said, put it in the file, and whoever, is next in line to either rent it or buy it, or.
Yeah, and if you buy, like I say, if it's sold, it's a moot issue, we don't have any jurisdiction over private
Right.
residences.
Okay. Okay. So there was something that came across the Public Health Excellent Grant Program.
Yep, so Jim just got back from vacation today, so I sent him and Rebecca a copy, I think last week. Did you see that email? About the grant opportunity for towns that collaborate. So I don't think Jim's probably had a chance to look at it.
Okay.
He just got back today, but we had a webinar, a regional coalition webinar, and that was one of the things they mentioned. This grant money was available to towns that wanted to kind of form a coalition, and you could do it a la carte, like if you needed help with nursing, you could work together with other towns to get a full-time nurse, or, so there was all different opportunities, and West Bridgewater also is getting information on it. Whitman, West Bridgewater, Abington, some of the same towns we worked in with the Bridgewater State University testing site. West Bridgewater needs a nurse also. We have a great nurse, but, maybe she wants more hours, maybe she wants some help, cases are picking up.
So is this
Um,
COVID-related?
It's actually, can be for anything, public health, that's a shared service. You have to apply for it,
Like
so it's not
soils?
just something you just get, you know? I mean, it could be, the problem is how long will the money, they said, oh, the money's not going anywhere, but I mean, I don't know if there's a guarantee that you'll get it
Right.
every year.
Excuse me, so,
So, but they
So I
do
went
want
to-
your executive board on, they want your executive board on board for each town that wants to join, so, just wanted to kind of bring it to your attention to let you know it's something I requested information on, and then I'll bring it to, I'll make sure Jim saw it when he's back.
so what's, our next steps? Because I'm trying to see what the, if there's a
So if it's
deadline
something that
and-
you're interested in taking the next step on, which would be filling out an application to join the coalition, we could take a vote on that. We'd still need the support of the executive board because it'd be town shared services, so that'd be the selectmen and the,
Yeah.
I'm sure town council probably want to take a look at it.
Okay, so we'll move this to vote on, the 4th?
We could do that because maybe that will give me time to see what,
Yep.
if Rob, West Bridgewater, because they're
Mhm.
really the town we work the closest with to see where they're going with it.
Okay. Okay. Okay, 1357 Washington Street.
That's very similar to 30 Andrew Road. That's the one that I brought the picture album in for you a few
Oh,
weeks
yes.
ago. Very similar, back and forth situation. Actually, they've dragged the selectmen in now, and I think town council is involved, and that is also in housing court. So I just wanted to bring it to your attention because the latest accusation in there includes a discharge pipe going into a pit of some sort, which is outside of housing, but, it's filing sort of a Title V complaint. So, one thing that did occur to me was that you could, as a board, ask Mr. Bucher to go just take a look and make sure there's nothing of concern, or we can, again, let it work its way out in court. We haven't placed them on the selectmen's agenda yet, correct?
No.
So the owner of the property never received the certified letter because he doesn't have access to the
No.
mail. Do we have it?
No, that's not the owner, that's the tenant.
Oh, okay.
It's like I say, it's another, and Rebecca will attest to this, it's another very messy housing issue. It will probably never get resolved fully until, the tenant is relocated.
So, his
But-
response in the email is saying that he has complied with the order. Is that my understanding? Does it
Yes,
make it
but-
to the follow-up
yeah,
email?
yeah.
5-gallon buckets were
Yeah.
emptied, same day,
Yeah.
55-gallon covered tanks. Yada, yada, yada.
Town council has spoken to,
A few times, I think, yeah.
and most recently, since the last complaint. And there is some sort of understanding, I guess, kind of explained things a little bit further as to the process of renting units and things like that. And there's no anticipation of them coming to a selectmen's meeting anytime soon, I don't believe. The homeowner would actually have to be the one to submit the claim. That's not.
So, other than, right now, we just have the note from the
So,
tenant
yeah,
stating that. we
Yeah,
don't have
so
any-
I just wanted to bring it to your
Yeah,
attention
okay.
because it's, again, another new complaint, and, I am supposed to
Yeah.
follow up on them.
So, if we send Bob out, is he looking at,
We would only look
The
at,
septic.
they claim that there's a
Discharge.
Drainage
discharge
pipe.
pipe going
Yeah.
from the laundry into an open pit out there.
I might as well send them out. I mean, that's my opinion. Do you need a vote, or can we just send them out?
I think a vote would probably just be
All right.
cleaner.
All right, well, I'll entertain a motion to vote to send our inspector out to review the discharge pipe at 1657 Washington Street.
Motion?
Motion Lisa,
Second.
second Matt. All in favor, say aye.
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 All right, so if you could send Bob out. Okay, Sue, updates on COVID, mosquitoes, and all that good stuff.
No, it's not pretty. We got, our budding towns have been seeing some hits on West Nile, so
I
again, it's still not
apologize,
triple
I am
A's.
clogged, Sue,
Okay,
I'm
I'm
sorry.
sorry. We got notified on Friday that Hanson has got some positive West Nile pools also.
Okay.
So it's still not triple E, thankfully, but they are seeing an increased West Nile activity. We really have, we're not to the point where we're gonna be doing, any kind of, my God, I can't think of the word.
Restrictions,
Curfews.
yes.
Can't think of the word. But just to let people know that, we're still really in the heart of mosquito season for quite some time till the first frost, so people need to protect themselves against mosquitoes. COVID, it's actually, today was an extremely busy COVID day. We've had 30 cases since the first of the month. 11 of those cases were vaccinated. 6 of them were in school, or school-age kids. The school has started up the test and stay option, and so far, so good. It's working out okay, and that's only for kids exposed in school, not by their family or friends or sports.
Now, wasn't there a staffing issue that they weren't?
There was, and
so-
they've decided they would try it because they want it to work, and so far, it's working out okay.
Even with the staffing constraints, okay.
Yep. So there is a little confusion because the test and stay is only for school and school-sanctioned sports. That means when you're not in those activities, you're supposed to be quarantining. So we are having some issues with some of like the younger kids that want to go off and do some stuff on the weekend, and really they still need to fulfill their quarantine. So had a couple calls on that today. But so far so good. It seems to be pretty organized over there. We had, I don't know if you saw in the news, there was an outbreak in Bridgewater in a classroom. I think they had to close down a 4th grade classroom the end of last week. That did trickle down to East Bridgewater a little bit with some mutual activities between Bridgewater and East Bridgewater students. So we kind of saw the effect of that. And that affected, I think, 5 East Bridgewater students. We're starting to, see some cases at daycares and that kind of thing again now, so. But the good news is, none of the kids have been terribly ill, so.
Well, that's good.
I have something on that.
Yep.
Little League asked me to get guidance on COVID for children in dugouts. Outdoor activity guidance has remained pretty much the same since last Little League season, but now there have been some parent concerns about COVID positivity and being in dugouts. Do we have anything we can offer them?
We don't, they still consider that outdoors.
Still considered outdoors?
Yeah.
Okay.
I think that if parents have an issue, they have the option of having their kid outside the dugout.
Absolutely, absolutely. They will, then
Be a
that's something
personal
they
choice,
can, yeah. They just wanted to make sure they were updated on all guidance before they
Yeah.
made any,
Or they can also mask up if they're concerned.
absolutely, those are both
And we
things.
did have
The Little League
2
board wanted to make sure
incidences
they
over the
were up.
weekend where we had people test positive that were involved in outdoor sports.
Yes.
So there is no quarantine requirements for outdoor exposure. So, I talked to 2 different coaches and, there is no quarantine requirements. They said it's never a bad idea just to tell families, hey,
Yeah.
by the way, somebody tested positive, although no one's required to quarantine, just be aware that somebody.
Now, what is the testing? Is it PCR or
It's either.
it's either?
Yeah.
Because there is a huge debate now in the medical community where they're now going back to say that a percentage of the positive COVID tests that were done actually triggered for the flu and not for COVID. So I've had several close friends in town who had tested positive and then took several additional tests that were negative, and then you're kind of left with, well, where am I?
Right,
You know what I mean?
know.
I have a negative test, I have 3 positive tests, so it's kind of like,
And if you ask the epidemiologist, they'll say if it was a PCR positive first, it doesn't matter what the rest of the
Right.
tests were. But if it was a negative, if it was a positive antigen test and you have a negative PCR within 48 hours, it wipes out the
Yeah.
positive PCR, so.
there's a lot of
But
variables.
yeah, they did change the guy. It used to say PCR for the quarantining, but now it says a test 5 days after last exposure. So we've been sending off like that guidance to a lot of different groups. Like we had the cheerleaders reach out to us looking, can you just give us copies of all the guidance? So, you know, just so they can be ready,
Yep.
anticipating something might happen. So the coaches have been super, you know, and everyone's got these email chains going with all their families anyway. You guys probably know because you have kids that play sports, so.
Could you send Little League just a copy of the guidance for outdoor?
Yeah, I can do exactly what I did for the cheerleading.
That'd be perfect.
Because they wanted a scenario, what happens if someone tests positive and they were outside? What if they were inside? What if they, you know, they wanted all the
Yep.
scenarios so that they knew if they got a call, this is how it would affect them.
And just so I'm clear, when I go back and whenever we're done with this, and see them, there are no close contacts outside, so it's, yeah, okay. Yeah, they're
And
gonna.
just so everyone knows, at Shaw's, you get 10% off your groceries if you get your vaccine there,
10%?
Oh, really?
of your entire purchase.
Really?
How long is that good for? How many times can I use
Go
it?
back and double dip, I know.
Double children.
What's the safe?
It's a great little incentive.
There it is.
Now, do you know who I email at East Bridgewater Little League?
Yes, it would be Donnie Davidson. I'll get you the email
Okay.
at the end of this. He's the president.
All right.
Or you can send it to the safety officer.
Oh, to the safety officer?
Yeah,
Okay, I got
that
that.
would
I know
be-
that email. Okay. And the only thing, we did a follow-up on the housing inspection this morning on Central Street, and the landlord had fully complied with everything, the 2 new appliances, new smoke detector, so that was refreshing. And I guess that's the only big things I can think of at the moment. The Harvard Street plans, I was not aware that Kim had sent them to Scott, but that is something we're probably gonna wanna look at because that field is underwater, and we might wanna have a second set of eyes look at those.
What else, Sue? Anything else?
Off the top of my head, other than the usual everyday craziness, nothing
Okay.
too much.
Okay, so, the item that we slid over, which was, vote to approve amended job description for health agent, to make any other changes in description of the job title. So, I honestly don't know if we're gonna get to vote on this tonight, but, I do wanna talk about a couple of elements that, Rebecca, you kind of have to send us a revised, health agent job description. So,
Posting, you mean, or?
I'm sorry? Didn't it come from you?
Yeah,
Okay.
you need another one?
No,
He was
I haven't.
mentioning
I
that
just,
that you sent. it.
yeah. All right, so, if you could slide a copy of it, Sue. So before the one thing I do just want to go down, and I just want to have, and even if it's not a discussion, these are kind of our options remaining, and we can scratch them off. We can continue to look at these or do nothing with these. So, in the whole genre of our current situation, one of the things that we talked about is review any of the candidates that apply to the Conservation Committee position that might fit the Board of Health position in total. It is possible for the board to review those applications from Concom. Some that might not be going forward, but might be a fit with us. So that question was asked, and the answer was yes, we can. after the Conservation Committee is done with their process. So the other option would be, and again, these are all, we can, you know, I'm just gonna go through what I've seen as our options, and then we can scratch them off and narrow it down to 1, 2, or none. So the other option would be a shared agent. From the Conservation Commission, is it possible to have one agent that handles both Conservation Commission and Board of Health, and then to provide that individual with a shared, and I think this is out of order, it's down at the bottom, I apologize. Well, one full-time administrative assistant for both departments, both Conservation Committee. So you'd have a shared agent within the building that does Conservation Commission and Board of Health, and then also a full-time administrative assistant that would support that same individual that manages both departments.
Does conservation already have a full-time administrative assistant?
No.
No, they don't. I mean, these are again, are just, you know, questions.
I was
not-
just clarifying,
Yeah,
because
I
I know that
don't-
we do, and then.
No. mm-mm.
They did, she
They
just
did,
left.
right.
Oh, okay.
So it would be, you know, again, this is just kind of looking at different options. So this bottom point, I apologize, that should go up right with the shared agent. The other option is a region shared agent where 2 or 3 towns within a reasonable regional area would have a Board of Health agent that would manage that, and other towns similar to our size, again, 2, no more than 3 towns. The other option is reposting the healthcare agent in totality, where our first initial go-around, we realized that we were probably, or after the process, that we were probably $10,000 below where we should be, and it's something that we do have the option of going back to the town and seeing about increasing the salary of that position and reposting that in a much broader and robust environment. And then the other item that is on the agenda is reworking the health agent's job description, title, roles, and responsibilities, as well as salary consideration, and then, you know, posting that revised position. So these are kind of, you know, in a nutshell, where we're at. So I just wanted to put all these out there. If there's, you know, no desire to do any of these, you know, we can just decide on where we want to go and then move on from there. But wherever we land on, we absolutely have to make sure that we have, and I just, you know, it's really kind of my notes, but I just put together a salary budget implication piece that just kind of says, okay, if we're going to make any adjustments anywhere, where are the salary concerns? Where are our risks? What's our expenses going to be for the for any consultative fees? And does that fit the budget? And if not, is, you know, the option to go out and see what we need to do to get in line so that we don't have any surprises at the end of the year. So that's what I have in front of me. If anybody else has anything else or wants to scratch any of these off, add to it, I think that would be the time.
So, the reviewing the candidates for the Conservation Committee, I'm not opposed to that, but we have to keep in mind that we're reviewing people that applied at a totally different job spectrum, so I don't know how fruitive that will be. The shared agent, with or without a full-time administrative assistant, if those departments already have a full-time administrative assistant, you're still taking the scope of the Conservation Commission agent and the health agent and making it enormous. The responsibilities for both departments to handle all would be huge, and just to say they'll have a full administrative assistant, they are not able to pass off their technical responsibilities to those administrative assistants because they're hired under their own guidelines for their job practice.
Okay.
So I would think that would be off the table.
All right. Matt?
I'm right there with Lisa right now, and I want to continue.
Okay, all right, and that's what I wrote, you know, too cumbersome, there's too much for one individual, I understood, like I said, just wanted to have the discussion on each of these.
Moving right down to region shared agent.
Region shared, I
What
think
towns
most
need an
regions,
agent?
yeah, most towns are in the same crisis, so then you run into who's assuming the benefit package, where they budget their time as far as dividing up hours. I don't really know if that's something that's able to be worked out through multiple towns. Obviously, if we had a shared agent with one, even possibly two towns, each town can't assume like, okay, we'll give you 10% of your insurance, we'll do 20, you know what I mean? Like, I don't know how the benefit component would fit in that role. That would be a huge undertaking for all three towns to restructure their budget and their,
I hadn't even gone there. I wasn't even thinking of that. I was thinking more along the lines, well, Bridgewater's got an agent, Halifax has got their agent, Whitman's got an agent, West Bridgewater's got an agent, Brockton's got an entire department, I'm assuming.
Right.
So we're already, there's a surrounding town, so you're already gonna go at least one town over, and I haven't even thought about whether or not they have agents yet. But we know that there's a list a mile long on the website looking for agents. So how far do you wanna go? Do you wanna share an agent with Wellesley? Do you wanna
No,
share an
that's
agent?
what-
I
that's
mean, like,
what-
this is,
and the
where are you
other
gonna
thing with
look
the
for?
sharing is the, post-COVID, the job for a health agent has just exploded. Whereas, you know, there's been a possibility of outbreaks or this or that. Now that's something that could happen at any given time. So to share somebody, that's a slippery slope.
I don't, it can be, but just, a lot of, both of those concerns that you guys had, I had as well. Now, I will tell you that I did have a chance to, you know, kind of speak to Jim a week or so ago about this. And he did not seem to share the same concerns that I had or you guys had as far as the accounting and dividing responsibilities. I think the locale, you know, where do we go? Where is it too far? I think that was, and I don't want to say a concern, but he actually, and again, he's not here, so I don't want to put words in his mouth, but I got the impression that was something that he had done in the past in other towns with other roles, and it worked out.
I think with other roles, if you're only hiring somebody part-time, like I know we did it with the animal control officer, multiple towns shared an animal control officer because each town didn't have the capacity to put somebody on full-time. My understanding, and without, I'm not gonna disclose names, but our previous healthcare applicant who withdrew his application because he has taken full-time position in another town would be a huge candidate to job share. But then, does that town continue to pay him where he's at and whatnot? Do we split the salary, but they assume his pension package and his insurance? Like, I'm not really sure how that would all fit together.
Yeah, I didn't get that far. It was just kind of a, you know, just like what we're doing here, just ran down some of the options, and, you know, Jim has far more experience than I did in this area, so I just kind of sought his counsel.
I
But
think-
those are all questions that
Yeah.
we can explore if we want to, you know, pencil that as do a deeper dive. You know, again, like I said, I just put these options down. I had some of the same concerns that you guys did, but actually Jim kind of eased those concerns, and then we were left with the locale more than anything else than the actual internal, you know, financial arrangements and things like that.
I
So,
mean, I would almost say, which would be another option, as opposed to sharing with another town, if we're not finding people that want to jump in and meet all the criteria, then looking at a shared health agent position within East Bridgewater, where you have two people that would split the salary, but would bring different components to the table and work on a 24-hour fit, so that somebody who maybe has a full-time job but is thinking maybe down the road they want to be a full-time health agent or want a side gig, they could come together with somebody else who may have, I have A, B, and C, this person has D, E, and F, and together we fit the criteria of the health agent, but we're doing it on a part-time basis instead of a full-time basis.
Like co-agents.
Yeah.
The Wonder Twins.
Exactly.
That was combined.
I would
I
think
never
that
thought
might
of it. I
be
think that's
better than splitting it with another
Okay.
town. Only because, for example, if we had an issue, whether it be COVID or something else, that affected the neighboring town that's sharing the agent, when it blusters, like, if you're already roped into this town and they're having an outbreak, you're pulling away from this town, but then if this town also gets an like, you kind of can't be everywhere.
Okay.
Whereas if it's two people within the town and there's an issue, there is options to take those people and maybe fund them for additional hours in a crisis timeframe.
Gotcha. Okay, so the other item I have down here is reposting of the healthcare agent. You know, as I'd mentioned earlier, we found out after the fact that we were probably $10,000 below what the market really is commanding for that position in totality. So, again, that was another ask that is, you know, even though our budget's done, does a possibility exist that we go, or are we able to obtain additional funds to put the position in the right salary range? And the answer there was yes, if that was something that we wanted to do.
Are we currently still only using Indeed also?
No, we posted on the Board of Health,
MHOA, yeah, and then
yeah, and then,
MMA too.
the MMA, Mass Municipal Association, Indeed, we posted that on the website and in Town Hall. So we covered all bases.
Because right now Holbrook has a position open. They got to post it, and they're only at 60K. I mean, we struggled at 70, 73. So
Is that the only agent in the office, though? Some of those towns have more than one.
I pulled the job description, and it looked like it was the only one. You know, the responsibilities were, the job position summary, the job responsibilities were in line with all the other healthcare agent positions.
Do we
So,
know how long that position's been on?
I don't. I just pulled it up.
Okay.
Northborough, no, again, I know Northborough is like an hour and 20 minutes away. They went out there, but they're 80 to 90,000, so they're probably in the right salary range. They're a town of 15,000 people, so very similar to East Bridgewater as far as population. I didn't do any of the other analysis as far as like per capita or housing values and things like that, but Northborough seemed like it was, you know, closely aligned community.
A lot of that might include certifications and licenses.
Rebecca, I apologize. I am
Saying,
so bad.
That may include certain certifications and whatnot that
Yeah, licenses.
bump that.
Oh,
salary down.
yeah, it was full boat. There's no question about it. Yep. Okay, so we just talked about reposting, and then the last item on here, which is on the agenda, reworking the health agent's job description, title, roles, and responsibilities, as well as salary in the position that, and posting that revised position. So, one of the things that would require probably the most amount of financials would be this position right here, is getting a true understanding of what our potential liability is with, on a consultative basis, you know, folks that we'd be utilizing outside. Now, I took a very rough draft, you know, using just the numbers that we got from Bob for August. I think it was $3,500. So I used a high of May, June, July, and August of $3,500, a low of January of $394, December $394, and then declining amounts from there. So just in that Title V element alone, that exposure is $26,000. Now, I threw a number in here of $2,400 for food, $400 for tattoo, and $500 for miscellaneous, and that miscellaneous is probably very low. So I came up with with an offset value of almost $30,000, $29,244. So give or take a couple of dollars either way. And again, I know that it's not a one-for-one transfer, but if it was, a $74,000 position and we had almost $30,000 in offsets, that brings the value of that position down to about $44,000. Now, again, I know it's not a one-for-one, but we need to look at what these dollar amounts are going to be
Yeah.
and how it translates into the budget. And, it is just something, whatever we decide to do on this list, whatever it is, we have to make sure that all these numbers match up.
But it's my understanding, and Sue, you would be able to help me, when they pay for a Title V inspection, is the client undertaking the cost, or is it the board
So we don't do any
taking a
Title V
portion?
inspections per se, so the fees that come in to the town cover, so it's a $200 fee for disposal works permit.
Yep.
That covers your inspections. That's always been that way though, even before, so, but it doesn't go into our operating budget, it goes into the general fund.
Okay.
So, no, so it's not coming back into our account to cover them, it's going into the general fund, so there's an application fee for everything. So we don't see that as a board, the town sees that in the general fund.
Yeah, I mean, I see where you're going, that is a factor, but it's also hard to put into figures because there's a waxing and a waning of that. Where there is a construction burst, you may see twice that amount, or, when it gets colder and there's less going on, you may see half that amount.
Well, I do, like, I did, it is, I guess, waning.
But I
From
don't
a-
know if you can go, can I just see that?
Sure,
Is
go
that
right
just from
ahead,
the
yeah,
past
yeah.
year? With
Well-
COVID, I don't know if this is a true representation of what a fiscal year would look like because so much was shut down for an extended period
Right,
of time.
I would say this, it's directionally correct, but we should go back to post-COVID year
To see where,
and see
yeah.
2 years and average them and get a number, and then, maybe it does all fall in, right? I don't, but when I just, took a first blush at it and said, okay, well, here's the value of, or the salary of the position, and then, if we take some things off,
And you're
what's
also
that-
looking
what's
at,
that value?
at a portion of that, we had a health agent, so they were only doing a surplus, not necessarily all. You know what I'm saying?
No, I lost from that.
So we had a health agent up
Correct.
until halfway through the year that
Right,
would have
right.
been doing these inspections, and Bucher would have only been doing the surplus that couldn't be handled.
Correct.
So those figures are still you know what I'm saying? It's,
Yeah.
we're going into uncharted territory. You could pull 5 years and come out with an average, but within those 5 years, we had a health agent. So the additional cost may have been if he was on vacation or he had
Sure.
a conflict, that type of stuff.
And we have those items should be in here budgeted for, any overflow or any additional items from past year's budgets.
Mm-hmm.
So I don't think coming up with a number that is, again, I'm gonna use the term directionally correct. It may not be 100% spot on, but again, I just think it's something that we need to take into consideration.
Sue, 5 months ago, I asked you to send me, and all of us, yearly amounts for Title V services prior to COVID. Remember that email? Okay. I can't find it now, but I know it happened.
Yeah.
See, I
So
thought
we had-
so too, I couldn't find it
Yeah,
either, right?
we have all of the Title V we have ever done,
Right.
very easily accessible.
Yeah, not
We
saying it's
have,
not.
so, there's that. There's also the fact that prior to the situation, whatever we're doing now as a board, we worked on a contractor basis. We had a health agent that didn't do certain inspections and did do certain, even before Bob, it was a contractor basis. We contracted out for food, we contracted out for septic. That's not something that has not happened before. It's not something, the way we're doing it now is the way we've done it for 20 years previous to the past health agent. So,
But that doesn't make how it was handled in the past, correct?
no, but the way that the Board of Health's job is becoming more and more and more complex, it is less likely that you're gonna find any one person that holds all of the certifications we need to handle and also can continually keep up with all the changes. It is probably a better idea to contract out the things we can't do and have someone, for example, Sue, have we ever contracted out tattoo parlor inspections? No.
You don't require any
We
certification.
don't require any certification for that. What were the other things you had on your list?
No, I thought, okay, so I went down, what I pulled out was, when I looked at the revised, okay, so in here, and again, I know that we can adjust this any way we see fit. Okay, coordinates inspections of tanning salons. So that, to me, when it says coordinates, that's gonna be an outsource.
I think that was just coordinates, because it could be either or, can do it or send it out.
Is there a
I don't know, I
professional
didn't write it.
certification for inspecting tanning salons?
I don't believe so.
Okay.
So, yeah, and, same, and so body art, tattoo, we have our regulations, so you are inspecting them to make sure they're in compliance with our regulations.
And the
We
same
don't
thing-
have any tanning salons currently in East
Currently.
Bridgewater.
But we
But
could.
we have, no, we've
We have
had,
had some
we
in the
had
past.
2 or 3 at one time when it was kind of
Thing,
popular.
yeah, popularity.
So, now, and I don't wanna get too much into the meat of this yet, because I know we're still talking about.
So as far as the Board of Health agent role, what inspections require certification other than soils and food service? That's it.
Okay, so, and that's where, again, not getting into the nitty-gritty of this just yet, but on this revised, it still lists as inspects and/or oversees inspections, okay? So where we have coordinates down here, we have inspects and/or oversees. So, but that's a certification that.
I'm not sure, so I
So
didn't write
on
this
food,
down.
on food service inspections,
Yep.
inspections of
Yep.
food service and retail food, on this bullet point, on this line item, it says inspects and/or oversees inspections. So, under this revised, it would actually be coordinates,
Well,
correct?
no,
Or
because
is that-
if oversees, if it says and or oversees, then you inspect it or you oversee the inspector that inspects it.
Right, but it would imply that the new health agent slash position, whatever this morphs into, actually would be doing some inspecting.
Which he would.
They could, but also it says and or oversees, so it doesn't say
Okay.
inspects and
It
oversees.
just, I was looking for some
Yeah.
consistency in the
So for the
wording,
duties
word.
listed,
Yeah.
soils and food inspections, they would either be doing the inspection or overseeing the inspector, whereas something like a tanning salon or
Housing.
housing complaint, you could send somebody else from the office because there's no certification required.
Okay. But again, on the food part, where there is certification for perks in Title V, that list just coordinates. So if we were looking to revamp that, that would have to be part of that. I shouldn't say have to be, but I would just think that we'd want that.
Are
verbiage to
you
be the
looking
same.
to remove the possibility of all certifications from the administrative role in the health department? Is that your thought? And
No,
then
but that seems.
contract
but that's-
everything out?
Well, how,
Because you just told me that was wrong.
No,
So
no,
now I'm
no.
confused.
So, I was just getting hung up on where we have coordinates, meaning that the testing would all be done via outside.
Not necessarily. Coordinates, if the health agent or whatever that position is
But that's
has
what-
that certification,
Right, but
coordinator
that-
could just be coordinating themselves
With
to
the
be out of the office.
applicant.
Yeah, okay,
with
but
the
that is
location.
one of the items that is a requested change.
Yes.
So if that was the case and we wouldn't have to change it, we could, to coordinate. So what I'm looking for was just some consistency in the verbiage of what might be outsourced. So if
Could
we're.
we change the wording to provides for the inspection
Oh,
of?
okay. Yeah, and that's, so again, that's why I didn't want to start to tear this apart just yet. I wanted to make sure that we were going to be able to get at financials that we could all align.
I think before we even come to financials, we have to decide what exactly we want them to do.
Okay, fair enough. So, now you'd ask the questions on what would have to be contracted out, right? So right now, obviously, Title V.
Well, no, like, maybe I'm speaking out of turn, but my goal here is not to delineate this position and then offer more money on top of that. If the person who is applying, like, I get the fact that we're having issues filling the role, but I'm not looking to hire someone for more money with less certification.
No, agreed. That's why I think we need to come up with a value element of this on what, you know, what, so if it was an inspector that did everything, understanding that, you know, it might be difficult to find. So if we had an inspector that did everything, under those everythings, here's the value of those. And then you have everything else. So you have dollar values of the components of the job description. And that should roll up, you know, to the salary. Give or take, right?
I think you're looking for a unicorn, and they don't exist anymore.
I get that, but if you don't look for the unicorn, you won't even find like
So
the substitute.
why don't we decide what we want the job to be first?
Okay.
What is the responsibility of the health agent, or whatever the position is going to be?
Okay,
And
that's
then
what I thought
can-
we did have. The only, like I said, I had a question on the food element, and it was more on the wording, and that's why I kind of broke these out into chunks, which was, and I again, I apologize.
Yeah, I've seen this, yeah.
Okay, so, you know, we got Title V, food, tattoo, and miscellaneous.
Yeah, but you're
So-
still worrying about the final salary number. We don't even have a job description for that thing yet. How can we give them a job description? If we put out the job description we have now, that includes Title V.
Correct.
So then these numbers are meaningless. because
Exactly. Right.
So
right.
let's stop
So
with
that's
that.
why these
Go
need to
back
go.
to what we want to talk about them doing,
Okay.
and then when we have that number, we can decide on a salary contingent on based on what we have everybody else doing.
Okay. So that goes back to the question that you asked, Matt, about, so if we go through this list, you know, the big items, right? Title V. So we're looking as a board to change that to a contracted item.
It's been working for us. We have done it in the past.
Yep, so that's what we agree on. So that's an item that we're looking to, which is currently contracted, and we're looking to maintain that as contracted. Food inspections.
That would be incorporated in the role of the healthcare agent.
Okay, not a contracted item. So the healthcare agent would have to be certified.
That's fine.
I think what we need to do is post the criteria as we have it, and then take out the certifications for soils and septic Title V and food service, and do a post paragraph stating qualified candidates who hold certifications in the following would be compensated, so that we would have a base salary for, say, a healthcare agent who's gonna do A to W. If they don't have certifications, the salary of that position would be X. And if they were certified, then that salary would bump up to offset the cost of having to contract out. And instead of giving a specific salary, we put a range. We're looking at somebody from 60 to 80, depending on certifications and job experience. I think our obstacle here is not the wording or the breakdown of the job, it's a supply and demand, that anybody who is in that role has multiple towns to look at and play the game, which is where everybody is in the world right now, because there's no employees anywhere in any field, everywhere is short.
Okay, I'm just gonna ask you.
And then also to add in a verbiage that we would be interested in a jobs share scenario for someone who would want to take on the healthcare agent in a part-time, in a part-time thing to buddy out. I don't know the
Okay.
correct, you know what I'm saying?
Yeah, now we just.
Because you may have somebody that's interested but has a full-time job that has food service, or somebody who just does soils and is willing to help out with X, Y, and Z, and maybe wants it as a side gig, and then those two people could come together or not. But I don't think the solution is to water down the job description and outsource everything, because now we're gonna have a person who's here who really has nothing to do in case there's a COVID outbreak, or in case, you know what I mean? Like, the everyday runnings of the office are food service, Title V, septic. So what are we paying them actually to do if there's no insurgence of duties? I don't know. I mean, if you don't have to do any food service and you don't have to do any Title V or perk testing, then you're basically an administrative assistant who's sitting in the office picking up the phone and making a phone call to book a food service or a Title V inspection.
Okay. I'm gonna ask you to go back into your Wayback Machine there, and I'm just gonna try to, because there were a lot of good ideas on that. And so you first started out by saying that put a post paragraph in,
Yeah, I
that
think
layer
we
the.
say, we are looking for a health agent to do the following, and list the bare fundamental job description, and then subsequently add at the thing, we are willing to compensate financially for those who are certified in food service, soil, septic, etc.
So,
You have a question?
Yeah, I mean, I would say just as, the person that posts the job and the job description, that might be a little too much. Someone might look at that and say, this town doesn't know what they want this position to be, and they're not gonna apply. And we did run into that situation with a couple of our postings recently.
We also are in a situation where, even though we have that, we get the exact same applicant pool we had the last time.
Right.
Which means we're doing exactly what I'm saying we're gonna be doing anyway, without having the benefit of.
I'm not opposed to outsourcing the certification issues. I just don't want to offer someone $70,000 for a job where they're not doing the bulk of what
That's-
they do on a
That's fine,
regular basis.
but that's why I say salary is the last thing we talk
Yeah.
about. We need to decide what we want the office to do first, and then when we decide how that position is going to be filled, we can decide what portion of the salary that's already earmarked for that position
Give and take, yeah.
gets it put in.
let me ask you two guys a question here. And Sue. Rebecca, if we got this in a Word document, I mean, I could do it, but, I mean, and we send it out to the board, because I've got hen scratching on here. And then we meet in a week, we don't wait 2 weeks. Now, again, it all depends on everybody's calendar and if they have enough time to do this. We get it back to you, and you send it back out to the board so that we can all see what our thoughts are in writing. So that way there, it would give us some time to kind of filter through what we've all talked about. Because they're all great ideas, but we've got to come to, we got to get this thing done. So if we schedule another meeting in a week, would that give everybody enough time to kind of put their thoughts on what they think the position should look like?
Well,
Or is that a fair ask? I don't know, I'm just,
did everybody, I'm assuming everyone read the reposting.
Yeah.
Did you have any issues with the reposting?
I had 0 issues with reposting.
Neither did I.
Yeah.
I don't feel personally that I'm qualified to dictate what the healthcare agent role is supposed to be. I think we're basing it off what the role has always been and then supplementing it. So I don't know if I, per se, have any issues that I would put in there.
my other call out would be, there's nothing in here about overseeing an administrative assistant if,
Because the health agent does not oversee the administrative
Okay.
assistant. They're coworkers.
so that's, all right. What was the other question I had in there? attends training. You know, I'd like to see if we can put down some specific items that are in the, you know, the online training that we talked about. There are some specific items that would help.
I think we could discuss that with the applicants. I don't know. I
So-
just think less is more. The more we put on there, the more we're gonna deter somebody who maybe
Well,
seems
but,
like it's
but we're also
overwhelming.
looking at, you know, we've taken out now, and we also talked about putting some items back in. So, again, I have to go back to, if we're gonna finalize this, then Title V comes off. That's good, that's a consultative area. Food is consultative. Now, tattoo, we said, does not need any certification, so that, you know, I just put a couple of bucks in there. So these two items, which we're currently doing it on a contract basis.
And let's not forget that if you wanna talk about the budget again, yes, the money that comes from the homeowners goes into the general fund, but then that goes into our budget the next year. And our budget gets set based on what we use, so it's not like this money is not being recycled through. We don't get it that fiscal year, but the
Right,
next
no, I
fiscal
don't.
year, we can base our budget request on, we did 30 more septics than we did last year.
Right, no, I understood.
Something else to
but
think
so-
about is if you continue to sub out, whoever the candidate is, continue to sub out septic systems, food has been subbed out, I don't know, 6, 7, 8 years, I have no
Yeah.
idea. If you continue to sub out, septic systems, then you almost have to change, it's not a full-time job. So,
That's what I'm saying, like,
so I think if you
without,
continue to sub out septic systems, you have to change the scope of the job entirely. So if I continue to be full-time, then you really only need a part-time health agent. It's not a 2.5 position office, it's a 2-position office, really, so, there's, you know.
But that, you know,
Well, that-
number
Well,
one,
it's
the
already
title,
have
the
to- we
position
have that
title
too.
would have to be changed anyway,
Well, that's
if we're
what
gonna be
I've got-
subbing all
I've
those
got.
things out, because it's not gonna be a health agent, it's gonna
Right.
be someone that
That is.
administers the office.
Mhm.
I really don't know what you'd wanna call
I
it.
mean, I just threw out health coordinator, but that's, you know, just something that came to mind. That could be administrative, could be anything, you know, that's something that, again, that position title has to change. So, okay, so if we go back to the list of options, are we down to the fact that this is where we're landing on, or is there another option in here we want to pursue?
well, I guess I'm in favor of posting the job position that was reworded and since the COVID benefits have ended and we're kind of getting into a resurgence where people are gonna have to go back to work, see if we get any additional applicants.
Okay, so that's what we spent the brunt of the time on, is reworking this job description and / job title and reposting it. But if we post it, we need to put some salary parameters. No?
I don't know, personally, I'm opposed to salary parameters, but I'm a medical professional, but most of the jobs do not give you that. You kind of it's based on experience. They don't say, oh, well, we're gonna offer this. I come into my interview and I say, I've done this for this long, I have these certifications, and they go, we're gonna offer you this. So I
So-
don't know if in the layman world, where,
I've got-
medical, if you have to have a job range. What do you think?
We do like to post.
Something.
A salary range.
Yeah.
Okay.
So then I would come up with a salary range based on experience and qualifications, certifications.
And just leave it at that,
And leave it at-
no dollars.
We could put the dollar amount in, but it's gonna be a pretty wide range.
Oh,
Whereas
exactly.
if
That's-
someone
that's
comes in
my
and has
concern.
all the certifications, they're on this end, and if they have none, they're on this end.
When conservation posted, they had a $20,000 salary range, and it was, their hire was 4,000 more than ours, and our job is way more encompassing than theirs.
Right.
So you definitely were way under. You could do a $20,000 range like they did, but it's gotta people.
Well,
do it.
before we go above what we have in there, we have to go and get that. We can't just throw it out there. We gotta
Well,
make
we're
sure we-
budgeted
have
for
a budget,
78
yeah.
already.
Right, I saw that.
At the moment,
Yeah.
yep, and I don't think you'd have any trouble getting another $5,000 to $10,000.
Right, right. Still has to be.
I don't think conservation had it when they advertised it.
Correct, I think
Yeah.
there's some movement going on up
Yeah,
there.
yeah.
Yeah.
So I apologize, what, they went and secured the funds prior to, or it's just a fluid environment?
No, I don't
If
believe
you
we have
had
the
the
funds
applicant
secured,
that
but
was
we don't even have an
exceptionally qualified and met every criteria, then you would go and try to inflate our budget to encompass that salary.
Okay.
I don't think there'd be a whole lot of resistance. I'm gonna say maybe just do, I don't know, 75 to 90 or
And also, if
70
you
to
found
90.
somebody that did food service too, you would be so it's the health.
You'd be
agency pays
taking
for
it off, yeah,
78.
so you'd kinda, it's a wax and a wane.
Rob is $75 a restaurant times two, so you're talking, he's probably like $8,000.
Yeah,
so.
there's an email with that, because I asked that
Yeah.
also. I have all of that
So,
information has already been
you
sent to
know,
us.
So you could do the range, and then you either find someone that does it all, or you find someone that coordinates and you pay them less. I mean, that,
Okay, so do we need to get together within a week just to finalize this job description, title?
I say we leave it as is,
As
and
is.
we
As
put a
I'm
range
sorry,
of
revised from what Rebecca sent, or as is?
the one Rebecca sent most recent, and then we put a range of 70 to 95 based on experience and certifications in hand. And see what we get.
Matt?
Rebecca, do you remember if your job description was health agent or something else?
Oh, it's right here.
Is that the?
It says health
Yeah.
agent right now.
Because of the immediate need, I think it would be good if, you could vote on, where you see this job and the job description. And if you have any changes you want made, maybe discuss it tonight. I don't think there are gonna be many changes that need to be made, depending on you, but if you could just vote on that, because of the immediate need, I think we could, if, the board decides, can move forward with the posting tomorrow.
Okay, so.
Yeah, I have a bad feeling we're gonna get the same thing back, even with the increased money. I have a bad feeling we're gonna get 13 applicants with no experience and no discernible applicable job skills, which puts us right back where
Well,
we are.
why was conservation, conservation got a good batch of applicants, right?
Yep, they cut it down to 3 applicants and 2 withdrew.
I
So
think the
maybe we're moving on.
overshadowing, I'm sorry, I didn't mean to interrupt.
That's okay.
The overshadowing on the health agent in general is COVID.
And,
Okay,
yeah.
Nobody
all right,
wants to
so-
take that.
No one wants to do
Okay.
which runs us
Fair
right
enough,
back
you're
to
right. Yep.
the guys that we want, the people that we want to do
Well, the
that
ex-
extra
yeah.
stuff,
Yeah.
the Title V stuff, because that's what we do most of, don't want to handle
Yeah.
COVID.
They want to be out in the field.
Yeah,
Yep.
so they don't want to be a health agent, they want to be a Title V guy, or Title V person.
Okay, so, if I'm hearing correctly,
I mean, the other direction, but it's gonna involve a lot of time and legwork, is that we remove the COVID outbreak criteria from the health agent and focus more on the soils and inspection component, and then take that budget and put it towards the town nurse and try to get somebody with a more consistent hourly availability, but that's a lot of restructuring.
Yeah.
so,
That's a lot of restructuring.
okay, so then, we're gonna take another swag at this. Other areas that we're missing as far as where we're posting this? I mean, I don't know,
Not that I know of,
Okay.
it seems to me that we're covering,
okay, as long as, I mean, Rick, I'm not the expert here, so I have to defer to you guys and just.
I would
Yeah,
think,
just
and
wanna
I
make
don't
sure.
even know, the soils certification classes, can they post it? Like, do they have, I don't know.
I think it's just.
Can always ask a
health,
question.
Site there that Sue had
Just
mentioned,
take,
that
you know.
post.
That one.
Yeah, it's the Mass Health Officers Association.
All right, so, we're going to go with the revised job description. as is, repost it as robustly as we can, with a salary range of 70 to 90,000.
1795, right? Was that what what your suggestion was?
Yeah,
Yeah.
70 to
70 to
95,
95.
based
95.
on job experience and certifications in hand.
So, do you need some verbiage from us as far as what Lisa just said, as far as,
Yep, just have that in a vote, you know, with these changes, and then I'll make the changes and go ahead and post.
And then I think when we start to review, maybe then we incorporate the fact if we have people that maybe have something but not everything, we can approach them with a job share. Because even though this is what we're posting, if we don't get anyone to fill that, we can tailor it and then just change the verbiage and offer it to people, I would assume.
Okay.
The job share is a really big deal. I mean, our board, like, you know, your board would have to go to their board, and then more than likely the selectmen would have to.
She's looking more
No, I
at
mean, two
doing
candidates
different-
for this role, but at half salary. Like, if, say, someone comes in and they're like, well, I have food service, I have no soils, but someone else is like, I love soils, but I don't want to do X. Like, maybe we can do each on a part-time basis to fill the void if we can't find one person.
I guess, yeah, see what you guys get after it.
Yeah.
After the 10-day cutoff.
Okay.
okay. So I'm gonna go through, I'm gonna try to rehash that in a motion. And then if somebody can take copious notes so that we can get this to Rebecca. If I misspeak, please interrupt. So, I'm going to make the motion that we repost the position with the revised health agent job description as sent to the board by Rebecca, with a qualifier of salary range of 70,000 to 95,000, based off of experience and certification qualifications. And I'm trying to wordsmith here, but aligned to the overall position. So whatever the verbiage would be to,
Yeah.
Applicable certifications.
there we go, thank you.
Experience certification, yeah.
Okay, so that's a motion, Lyons.
I'll second it.
Second, Matt.
Third.
Yeah, I've heard that one before.
Any discussions? Hearing none, all in favor?
Aye.
Aye. So that passes unanimously.
How long were you gonna post that for?
10 days is the, minimum.
So I would just respectfully request that you get right on that after the 10 days, because we're coming into licensing season, and I barely have time to type a paragraph of minutes.
Yeah.
The phone doesn't stop, so.
Okay.
So, and not that, it can be replaced by what you know and do, but can we get you some additional hours from, answering the phones, taking notes, things like that?
It was not that easy. The phone call,
No, I know.
phone questions aren't, I want a copy of this, I want a
I
copy
know.
of that. They're
Okay, all right.
detailed.
I just want you
I wish,
to.
believe me, even my senior helper tries to answer the phone when she's here, but they're
Okay.
not questions that an average layman can answer. So.
Okay. Just wanted to put it out there.
So after the 10 days, I'll go ahead and put together a packet on the 10th day, like I did last time, send it to you three, and then send me the top three. We'll set up interviews, the process will be rather.
And the chairperson will not reach out to the candidates individually to ask
Yes, do
them
not do that.
questions.
Thank you.
Okay, that's, all right, that is a lesson learned and will be ingrained in me forever, so. And thanks for that help, Rebecca, really, it's,
Yeah, now that we have.
it's not my Monday through Friday, so. Okay. I apologize for the length, but it was, we had to muscle through this. And it's still an open issue, so let's hope for the best here. Does anybody have anything else? Okay, at this time, I'd entertain a motion to adjourn.
Motion.
Motion, Matt.
Second.
Second, Lisa. Any discussions? Hearing none, all in favor?
Aye.
Aye. We are adjourned. Thank you, everybody. And that concludes our Board of Health meeting for Monday, September 20th, 2021. Have a great night.